Tomorrow, a federal mandate takes effect, making all public housing all across the country smoke-free. But the city's smoking ban at Nycha complexes, that actually goes into effect today. Health reporter Aaron Billups takes a look at why city leaders say this is a step towards a healthier New York.
With 400,000 people living in public housing, it's really kind of like getting an entire city to go smoke-free.
Residents are mixed on whether smoke-free Nycha is a good thing.
I think it's good.
Why?
Because, I mean, all the smoking buildings, people who smoke in the hallways and everything. We have elderly in the building, we have children coming in and out of the building.
Houses should care about other stuff, like the elevators and the staircases and stuff. This is like something really minor.
Health officials, though, say it's actually a big deal.
This is a priority for many families. Over 70% of respondents to a survey in 2012 said that they would prefer to live in a smoke-free building.
Nycha residents are predominantly people of color, and the data show us that people of color in New York City are absolutely being exposed to secondhand smoke at much higher rates than other New Yorkers, and that's absolutely unfair.
Taking a page from some of the 600 authorities already smoke-free in the country, Nycha assembled an advisory group made of residents, health experts, and community advocates who met over 18 months, creating a guide to launch the new policy.
Those recommendations included everything from making sure that folks had access to education, both about the rule as well as about, the harms of tobacco, the history of tobacco companies' targeting of communities of color.
The city health department is also working on ways to increase the number of community health workers on Nycha campuses to support residents who want to quit. There's already a team serving 5 developments in Harlem.
A lot of our staff, they're residents of the developments that we serve. They know that you're trying to deal with the social determinants of health, underemployment, unemployment, poverty, illiteracy, and that we can recognize that and there to help you and not judge.
Nycha says enforcement of the rule will take the complex reasons residents smoke into account, but if complaints mount, a resident could end up in housing court. But Nycha's Health Initiatives Director says the main focus is on improving the health of non-smokers and smokers alike.
We thought that there was no reason that a resident should be evicted, specifically and exclusively because of smoking within buildings.
Aaron Billups, New York 1.